Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Remember, the VA wanted to shave off 10,000 employees this fiscal year, actually, and their plan to do that was through natural attrition, just waiting for veterans, waiting for employees to retire, get fired, quit, move on, what have you. That was all in their plan to reduce by 10,000. Now, I get it. If you were like me, thinking, wow, that makes zero sense, considering that there was a big influx in new veterans achieving service-connected disabilities and being able to now access the Veterans Healthcare Administration. Not to mention the opening of eligibility to another 1 million plus veterans out there. There is a headline, and that headline is VA plans to keep growing healthcare workforce if Congress fixes $12 billion shortfall in fiscal 2025. So it's confusing, a bit bipolar, if you will, messaging coming from the VA. Now, with that, please hit the thumbs up, subscribe, share with a friend, all that good stuff. I truly appreciate it. If you want to support the channel in other ways, you could do that by becoming a member. Go to the homepage. You'll see the highlighted members and a join button, or you can scroll through the little tabs there, videos and shorts and lives, and you'll get to memberships, and you can click on that. Thank you so much. All right, so this came out on the Federal News Network, and there's a sub-headline. The Veterans Health Administration planned for a net zero growth. Well, I guess that was its original plan for its workforce this year, but kept hiring amid unprecedented healthcare demand. Again, more veterans than ever filing for first-time claims, pretty much, and then you had that additional lowering of the barrier for healthcare to another 1 million-ish veterans. This just came out September 11th, and I'm sharing it with you here today. Jumping into the actual article here, the Department of Veterans Affairs plans to keep growing its health care workforce next year to keep up with a surge in demand for its services, which is what I was pointing out when they said they were going to lower their head count by 10,000. I said, well, that seems pretty ridiculous because they just allowed another 1 million veterans to be able to have access to VA healthcare. Doesn't mean they all are, but they now have access, eligibility to get VA healthcare. Not to mention any new veterans filing claims, especially through basically the marketing efforts, if you will, of the PACT Act and other avenues for claims. You're getting more veterans filing claims and having access to VA healthcare in that way. So to cut your workforce by 10,000 when you have a wave of potential, I guess, patients coming at you seems ridiculous. So anyway, let's move on. So it says here, but before it can do that, the VA is asking Congress for an additional $12 billion to cover a projected shortfall in its fiscal 2025 budget, which we're all well aware of now. Under Secretary for Health, Sharif Ellenhall, said supplemental funding in fiscal year 2025 would allow VHA to increase its headcount by 5,000 employees. So we're going from a reduction of 10,000 to a plus of 5,000. So that's a net difference of 15 just for those keeping count. It's and we wonder how the overall budget get messed up. All right. Compared to its peak staffing in mid-June, when it had a record 400,000 total employees. The Veterans Health Administration, he added, needs about a third of the money just to keep up with rising costs of prescription drugs and prosthetics. VHA plans to keep hiring to stay ahead of the higher than expected demand under the PACT Act. Moving on, the 2022 law made more veterans eligible for VA healthcare and benefits if they were exposed to toxic substances during their military service. There's a quotation here. "We do not think we need to grow above where we are right now in headcount," Ellenhall told reporters Monday. What the additional supplemental funds or funding would allow us to do is make the right investment to grow our capacity even further, he added. Interesting. Ellen Hall said VHA needs supplemental funding, in part because medical network directors say they may not necessarily be able to they may not necessarily be able to active new clinic space. Must be activate new clinic space or offer new services, even though they felt they could recruit the right folks to do it and open new services. Another quotation, any health system should be able to make investments to be able to meet the public health and care needs of their community. And so when it comes to activating new clinics, new services, and really catching up to this very high spike in demand, the $12 billion will be needed to do that, he said. You need staff for activations. You need new staff to open new services. And right now, our colleagues throughout the field are struggling to do that because of the significant demand and growth. Moving on, no longer net zero growth is a kind of another sub-headline in here. VHA's current plans to keep growing its workforce diverge from the fiscal year 2025 budget proposal sent to Congress. The VA, in that spending request, proposed reducing its workforce by 10,000 positions next year, with most of those jobs coming from VHA. Which is why this is just so baffling. How in the world, first of all, I never would have expected to see we're going to reduce our workforce by 10,000 on the heels of the PACT Act and on the heels of the expansion to include more than 1 million veterans additional eligible to get into the healthcare system. So I never understood where they came up with reducing by 10,000, and now it's done a 180, and we need more, and we need another 5,000 to start up these new services amidst all this demand. Anyway, moving on. VA Secretary Dennis McDonough told reporters on Friday that the VHA has been managing its workforce in a tighter fiscal picture, and is taking a more targeted approach to hiring after it exceeded its hiring targets last year. VA officials have repeatedly stated that VHA isn't going through a hiring freeze, but Federal News Network previously reported that VHA at the beginning of this year advised medical center leaders and human resources professionals on rescinding tentative or final job offers made to prospective employees. VHA, according to an email obtained by Federal News Network, told officials to only rescind job offers only as an action of last resort to manage the overall headcount at their facilities. VHA planned on net zero growth for its workforce this year after the agency hired more than 61,000 employees in fiscal year 2023, its fastest rate of growth in 15 years. Rather than keep hiring a significant number of employees, VHA is focused this year on increasing the productivity of its current healthcare workforce through its access sprints. The agency increased the number of veterans that each VA provider sees for appointments and offered night and weekend clinics. We began this fiscal year with the goal of essentially managing our growth with the same level of staff by undertaking the access sprints, which was a very explicit effort to improve productivity per clinician, Ellen Hall said. However, he said VHA still grew its workforce by more than 2% this year because our teams across the field are making the right decisions where we think they need to bring on these types of critical staff. More than 740,000 veterans have enrolled in VA care since President Joe Biden signed the PACT Act into law in August 2022, about 33% increase compared to the 2 years before the legislation. Since the PACT Act was signed into law, 891,000 veterans already enrolled in VA care saw an increase in their priority group, which makes them eligible for more generous health care coverage package with lower or no copays. The VA assigns a priority group to veterans based on critical criteria that include disability rating, income level, and military service history. Ellen Hall said 500,000 of those veterans may not have seen an upgraded priority group without the PACT Act, and that this surge in upgrades contributed to unprecedented healthcare demand. The agency so far this year provided 116 million appointments and is on track to reach 130 million appointments to veterans by the end of the fiscal year of 2024, beating last year's record of 120 million appointments. Though its access sprints, wait times for VA primary care appointments went down 5% for new patients and down 9% for new patients between July 21st and August 17th. Ellen Hall said VA decreased wait times because of increased hiring and making sure we are maximally productive as we see patients while doing everything we can to prevent clinical or clinician burnout. During the same period, the department saw increased appointments for primary and mental health care, as well as several categories of specialized care. We are seeing more care demand than we expected, although we grew faster than we have in the last 15 years. Ellen Hall said $12 billion in supplemental requested funds would allow the VHA to keep adding more appointments to continue driving down wait times. If we get those funds, we will be able to grow, and we think we need to grow in order to keep up with the demand and not see wait times go in the wrong direction instead of the right direction as they have been, Ellen Hall said. Community care, health care that veterans received in non-VA medical facilities accounted for about 40% of the total VA care in fiscal 2023. Between October 2023 and July 2024, the numbers of veterans receiving community care grew by 45%. Ellen Hall said VHA is also dealing with a significant higher cost for prescription drugs and prosthetics. Nearly $4 billion of the $12 billion supplemental would go toward increased costs of prescription drugs and prosthetics. VA delivered $103 million in 103 million prescription drugs to veterans so far this year, about 4.5% increase compared to last year. However, prices for non-retail pharmaceuticals went up on average 22% between January 22nd and January 2023. More than half of veterans receiving VA care rely on its prosthetic services, which cover everything from prosthetic limbs to eyeglasses and hearing aids. In the first 3 quarters of the fiscal year, the VA saw more than 16% increase in its prosthetic costs. Leaders of the House Appropriations and House VA committees introduced a bill last Friday that would give the VA $3 billion to ensure the department can keep paying benefits to veterans for the rest of the fiscal year. The emergency funding bill, however, does not address VHA's $12 billion shortfall for fiscal 2025. The VA gets funding for its mandatory health and benefits programs a year before the current fiscal year to avoid any disruption from a government shutdown. VA officials told Congress about the $15 billion total budget shortfall in July. Lawmakers say it's the largest funding gap in the department's history. House Republicans are frustrated. VA leaders notified them about the budget crunch a few months after submitting their fiscal year 2025 budget request and appearing before both committees to explain their budget needs. VA has no excuse for failing to budget for the PACT Act, but we must hold the veterans harmless. House VA Committee Chairman Mike Bost in a hearing Tuesday. Dr. Sharif Ellen Hall also tells us there will be a $12 billion hole in the healthcare funding for next year, but VA stonewalls us when we try to get to the bottom of it. Ellen Hall told the committee on Tuesday that the $12 billion supplemental request would go directly into VA healthcare, would allow us to grow our workforce instead of having to attrit our workforce to maintain within the budget. And with that concludes it. Thank you so much for watching. Really appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.